Welcome back to It's Your Case, presented by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today's example, here we have a 6-year-old female Boston Terrier who is about 6 weeks post-estrus. She has PUPD and inappetence. Once you have reviewed the radiographs that go along with this case and used your systematic approach, then you're ready to watch this video. Recently, if you've been following us, we have looked at various gastrointestinal cases and discussed a lot about small intestinal size and other imaging features that might help us to determine if a patient may have an obstructive lesion. As part of our systematic approach, of course, we have to consider all organ systems. As I go through the lateral radiograph on our little Boston Terrier today, of course, with small intestine in mind, I can see lots of regions where there's gas that's clearly either small or large intestine, some segments here that clearly represent small intestine based on their size and position. As I come more towards the caudal abdominal quadrant, I'm seeing very enlarged, distended, almost sausage-like tubular structures. I can kind of get the impression that these join, but they're difficult to trace. I'm going to go to the other view and stick with assessing that caudal quadrant. I see a general sort of fullness of soft tissue bilaterally here. And again, it's hard to tell whether these are sort of tubular margins or whether these structures are all sort of packed together in the caudal abdomen. I think the key findings for me right now would be to consider the fact that if I was going to look at the diameter of one of these structures, we're way up over 3.5 centimeters. So this is extremely enlarged. Additionally, the location being somewhat more centered in the caudal abdomen. As I continue to look at the caudal quadrant, when I trace the structures entering the pelvic inlet, one of the best places to start is, of course, with the large intestine or descending colon, because it's often filled with either gas or feces and it gives us that nice contrast. In addition to the gas-filled descending colon at the pelvic inlet, and of course the urinary bladder, which is another great landmark that most of us are quite adept at locating, I see some additional soft tissue opacity between those two structures here. Normally what I would expect, if you look at the ventral aspect of the bladder, there's this whiff of fatty opacity or fascial plane. I'm going to enlarge this. This sort of nice thin fascial plane here that we can see ventral to the urinary bladder, a fascial plane similar to that, representing the serosal margin of the bladder and the serosal margin of the colon, would normally be seen. In this case, instead, we're seeing an increased soft tissue opacity that I've demarked with these red arrowheads. So if we sort of take everything into account up until this point, key findings: increased opacity at the pelvic inlet, between the colon and the bladder, highly consistent with the location of the uterus. We don't normally expect to see the uterus in intact dogs until it starts to become enlarged. We'll talk about the causes of uterine enlargement in a minute. Although I can't necessarily trace this to join up with these structures, the fact that I have enlarged tubular structures that on the ventral dorsal view, I appreciate that they sort of extend bilaterally in the abdomen. And I think the other key finding here is the extremely large diameter and the uniform soft tissue opacity. All of these things taken together would cause me to conclude that I'm dealing with a severe uterine enlargement here, occupying the majority of the caudal abdomen. To comment a little bit about how I know this isn't small intestine, and in some cases of mild uterine enlargement, it can be harder to tell. The size being so large, the fact that the opacity is so uniform soft tissue, and the fact that I can trace uterine enlargement at the pelvic inlet are the main things that allow me to feel confident that this is uterine enlargement. The normal uterus, as I've said, is generally not seen radiographically, but of course during a normal pregnancy, it will start to become visible as the gestational sacs increase in size. Fetal mineral will be noted at 45 days approximately in dogs and as early as 36 days in cats. So the first thing I want to think about when I have a uterine enlargement is to hopefully I'm not dealing with a normal pregnancy, because if that were the case, our management would be totally different than if we're dealing with pathologic uterine enlargement. In this case, I would expect to see fetal mineral at this stage and with this size of uterus. So we can't distinguish radiographically the various causes of uterine enlargement, such as mucometra, hydrometra, or pyometra, But with the provided history, the most common differential would certainly be pyometra. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.